Well, of course, here at CHEO and at the Ottawa Children's Treatment Centre, this is an organization that has always been about the well-being of children and youth, and so we share the alarm that so many people in our community have about the opioid crisis across the country that is reaching Ottawa, and around mental health and addictions for young people. And so we're very committed to doing whatever we can, working with other healthcare organizations, school boards, parents, families, the media, the community at large, police and public health, to really help kids and families be their healthiest and stay their healthiest.
Definitely, we're always concerned and upset when we hear about increased drug use amongst children and youth, and also in the larger community when there's accidental overdoses and people that are dying from using drugs. Really, we know that adults that go on to use drugs and have real problems with them sometimes start using when they're younger and children, and that's why we really need to focus on preventing young children, youth from starting to be in a position where they're going to be using drugs. And we talk to children, youth and families about that every day. Here at CHEO, when a child or a teenager comes in with any sort of problem, we always assess them, and we always make sure that they're medically and psychiatrically stable and safe. And so we don't ever turn anyone away. Of course, once they're stable from a medical point of view or a psychiatric point of view, then we connect them with the service that they need. And every situation is different. Sometimes that means connecting them with services that we have here at CHEO and OCTC, and sometimes that means connecting them with our partners in the community. But that's our role, and we want to continue to work with children, youth and families and all our partners to make sure that these kids get the services that they need when they need it, and that the community has enough of those resources for all.
And have you seen many parents or teens coming in, for that matter, who are battling a drug addiction, parents wanting to get help for their children, or teens coming in and realizing they have an addiction and wanting to see what resources are out there?
So while we have heard a lot about an increase in accidental overdoses in our community over the last very short while, we're fortunate that here at CHEO we haven't had a child come in with an accidental overdose since the beginning of April. While we know that is happening more in other places in the community, we do often work with, in all sorts of different places, children and youth who are either going through the usual experimenting with drugs, which we see across many children and youth, and also those that sometimes do have more significant use that's problematic. And in those cases, again, we are working with our community partners to provide the children and the families with information that will be helpful to them and connect them to the services that they need.
Maybe I can just add something there.
Yeah.
And I think, because I saw a video from you, that you went to the Lisa McLeod
That
Summit.
is correct.
And as you will know, then we had some of CHEO's experts there. And so mental health and addiction often go together. And so we have put a tremendous amount of effort into improving our access to mental health services at CHEO, reducing the wait times, being able to see young people more quickly so we can provide them with the supports that they require. We're also working with the Canada Parents Group and working closely with Sean O'Leary to produce some materials that can be used in the emergency department when a young person is there or when their parents are there, so that we can provide them with better tools and information. And we're testing those materials now with parents and with young people to make sure that they actually do provide the information and resources that they're looking for. So for us, the priority is to work with parents, to work with young people, to work with other healthcare organizations, so that between all of us, we can make sure that the community is there to respond to young people in crisis and provide the support that needs to be provided.
And what do you think should be done to address the needs of young people? And like, what should be done differently to help continue to do this, and just what should be done as a whole?
So I think we need to think of young people in three different groups. There are all young people who should be getting messages around prevention and useful teen-oriented information, recognizing that many teens will experiment with drugs and alcohol and it will not become a problem, but that we need to give them information. Then there's a second group that are starting to engage in problematic behavior, and we need to make sure, principally through the schools, that they can be identified and they can be supported. And then finally there's the group that is addicted, that has developed a serious problem, and we need to make sure that the resources in terms of treatment and support are ready and available. And I think all organizations, CHEO included, have a part to play with all three groups: the universal approach for all young people, the more targeted efforts for those that are starting to develop a problem, and then the more intensive intervention for those who have developed an addiction. One of the things we've seen in this community in recent weeks is a big increase in the number of young adults and older adults arriving in emergency departments outside of CHEO with a drug and alcohol problem generally, and with an opioid issue in particular. And we know that many of those people, when they were younger, when they were teenagers, might have been when they started developing a problematic use of substances. And so that's why that early intervention, and particularly working through schools, is so important.
Is the distribution of naloxone a thing that CHEO does? If someone comes in looking for it, is that possible for them to get?
Yes, so there are many aspects to the prevention piece, and one is when somebody has overdosed, that there's a preventive or intervention that can be done to save a life. And definitely there's been a lot of progress in ensuring naloxone is available to whoever needs it without any question at all. And CHEO does have in our emergency department and also through our pharmacy naloxone kits that they distribute very freely. And not only do they give the kit, but they teach how to use it. So really we encourage any teen that may find themselves in a situation where somebody is using drugs or using opioids, avail themselves of being able to use the naloxone kits and have them available. And likewise, any parents who find themselves in a situation where their children are using, if they have a kit and they know how to use it. And we support that not only through giving it out at CHEO, but making sure that other pharmacies and community organizations do the same.
And you mentioned that you haven't seen any overdoses here since the beginning of April. I'm going to guess some must have happened before that, but that none has happened since then must be a very good sign that, things, I guess you could say, are improving, or more awareness is being shared, because within over a month, no one has came to CHEO with an overdose.
We are hopeful that this is a sign that things are improving. One of the strategies that everybody has decided is very important is to make sure we understand how many individuals are using and getting into trouble when they're using. And so now we do report, as does every other health organization locally and provincially, so we will get a much better understanding of whether we're making gains over the months to come, and we hope we are.
And lastly, whenever someone comes to CHEO, how do you make the decision to admit a young person, and what are the physicians entitled or not to do under law for the right of the person and with the medical leaders and such?
So anyone that is in acute, life-threatening or unstable medical or psychiatric way will be admitted and cared for until they are stabilized. If there's a child or youth that really is in a life-threatening situation, whether that's psychiatric or medical, then we always have the ability to ensure that they get the care that they need, and we can make sure that we can save a life. If someone is able to make a choice and they're in a frame of mind that they can make understand a choice and make a choice, and they refuse care, then it becomes a little bit more challenging to, you can't force someone to receive that care unless you think that their life or someone else's life is in danger. In that situation though, we continue to work with that person to try and help them receive any sort of care that they might need, and of course involve their families when that's permitted into that decision. So we never refuse or never are unable to provide life-saving care. That always happens. When it's a less intense need for care or a less urgent need for care, then we work very hard with that child or youth to get them the care.